So today we are going to discuss the posterior triangle of neck. This posterior triangle is situated behind the sternocleidomastoid muscle. When you see the sternocleidomastoid muscle, detailed study of the sternocleidomastoid in my last lecture. In this we are going to study today the posterior triangle of neck. So what is the definition of posterior triangle of neck? It is a triangular muscular space situated behind the sternocleidomastoid muscle. So the area which is behind the sternocleidomastoid muscle, that is we are going to call it the posterior triangle of neck. This posterior triangle, which is you are going to get the, as we study the quadrilateral space of the neck or the side of the neck, that is the obliquely running sternocleidomastoid, and that is dividing the anterior area triangular space forming the anterior triangle of neck, and posterior area which is we call as the posterior triangle of neck. So what you have to remember in this posterior triangle, it is a triangular muscular space which is situated behind the sternocleidomastoid muscle, called as that is a posterior triangle of neck. Then boundaries of posterior triangle of neck. So it is bounded by the anteriorly and posteriorly and inferiorly, and base is also inferiorly, apex is on the superiorly. So you have to mention the first anteriorly, the boundary of posterior triangle. It is bounded by the posterior border of sternocleidomastoid muscle. This is a posterior border and this is an anterior border. So anterior border is taking that is a boundary for the that is posterior boundary for the anterior triangle. So posterior border of the sternocleidomastoid making the anterior boundary for the posterior triangle of neck. So anteriorly by the posterior border of sternocleidomastoid muscle and posteriorly by the anterior border of the trapezius muscle, and inferiorly we have the middle 1/3 of the clavicle. So this middle 1/3 will be forming the base of the posterior triangle, and apex lies at the superior nuchal line. So you have to remember superior nuchal line is above here, apex line, where the sternocleidomastoid and trapezius meet together at the superior nuchal line, that is forms the apex of the posterior triangle. So boundaries of the posterior triangle are anteriorly it is bounded by the posterior border of the sternocleidomastoid muscle, posteriorly by the we have the that is the anterior border of trapezius, and inferiorly middle 1/3 of the clavicle, middle 1/3 of the clavicle, apex lying at the superior nuchal line. So nowhere concerned with the base of mandible, line joining the mandible to the mastoid process, that is all includes in the that is the anterior triangle. Now we are going to talk only the superior nuchal line, that is the apex line, where the sternocleidomastoid trapezius meeting, that lies in the superior nuchal line. So that is the apex, base, anterior, posterior boundary of the that is the posterior triangle of neck. So next you have to go to the next part, that is what is the roof of the posterior triangle. When you go to the roof of the posterior triangle of the neck, it is formed by the investing layer of the deep cervical fascia. Means in the neck region we call as almost all, it is a word relates to the cervical region, also covering the deep fascia, that is we call as a cervical fascia. So that you have to remember, it is an investing layer of deep cervical fascia forming the roof, and also it is formed by the, you have to mention, it is formed by the one thin muscle I have told, neck covering, that is almost all covering roof area, that is the platysma. So you are going to get the main important investing layer of deep cervical fascia, which contains the first forming the roof structure is platysma covering. Then next we are going to have the that is the external jugular vein, and we have the greater auricular. This is a nerve which is a greater auricular, and one more nerve going to here is a lesser occipital. Greater auricular, lesser occipital, external jugular vein, and we have the three nerves which are going in the above the clavicle. Those we call as the supraclavicular nerve. So supraclavicular nerve which are lying above the clavicle, those supraclavicular nerve Then we have the greater auricular nerve and lesser occipital nerve, and we have the external jugular vein. So these all structures will form the roof of the posterior triangle of the neck. So posterior triangle of the neck is formed, roof is formed by the investing layer of deep cervical fascia. This investing layer of deep cervical fascia, which is we call as containing mainly the platysma muscle. Then we have the structures like supraclavicular nerve and greater auricular lesser occipital nerve, and we have the external jugular vein. They will form the roof for the posterior triangle of the neck. Then next we go to the, what is the floor of the posterior triangle? When you see the floor of the posterior triangle, it is formed by the, even you get the prevertebral fascia of the cervical region. Very deeper to that, so we have the muscle forming the prevertebral fascia covering the deeper part of the neck region, that will form the floor. So floor is formed by the muscles from the above downwards. When we go, there are the muscles which are deeper part of the neck region. They makes the floor for the posterior triangle of neck. What are those floor forming muscle? Semispinalis capitis. Muscle known as the semispinalis capitis. Then we have the splenius capitis. Then we have the levator scapulae. This is a muscle which is, you have the levator scapulae. Then we have the here one muscle, three muscles we are going to get: scalenus anterior muscle, and scalenus medius, and scalenus posterior. Also you have to add here the first digitation of the serratus anterior. So these all structure will form the, that is the floor of the posterior triangle. What is the floor is formed by the posterior triangle? It is formed by the muscles from above downward. That is, we have the semispinalis capitis, splenius capitis, levator scapulae. Then we have scalenus anterior, scalenus medius, and scalenus posterior. Here you have the first digitation of serratus anterior. These all will forming the floor of the, that is the posterior triangle. So these are the contents. You can see subclavian vein, we have the subclavian artery, and these are the trunk of brachial plexus, where you can see the trunks of the brachial plexus, then subclavian vein, and we have the subclavian artery. They are all we are going to study in the contents of the, that is the posterior triangle of neck. So almost all the floor you have to remember, and its contents diagram, this you have to practice. Then after this we are going to have the divisions of the posterior triangle. When you see the posterior triangle, subdivisions of posterior triangle now. What is the, again it is also divides into a two triangle subdivision. How we have come across in the anteriorly four subtriangle, like that in the posterior triangle also it is having the division, subdivisions of the posterior triangle. Upper large area, which is we call as the occipital triangle, and below which is we are going to get lower area, which is we call as a supraclavicular or subclavian triangle. Supraclavicular or subclavian triangle. These are two subtriangles. How they are? By the division, which is divided by the muscle inferior belly of omohyoid. The inferior belly of omohyoid divides the posterior triangle into two subtriangles. Large upper area, this is we call as that is the occipital triangle, and large, that is small lower area, which is we call as the subclavian triangle or supraclavicular triangle. So what are the boundaries where you can see here? Occipital triangle is bounded anteriorly sternocleidomastoid, posteriorly trapezius, inferiorly by the inferior belly of omohyoid muscle. That is the boundary of the, that you have to remember about the occipital triangle. Going to the next, below smaller area, which is you have the smaller area of the that is we call as a subclavian triangle or the supraclavicular triangle. So above the clavicle it is there, you can remember as a supraclavicular, and the subclavian triangle we call. So it is bounded anteriorly. We are going to get anteriorly, we have the sternocleidomastoid, and posterior superiorly we have the superior belly of omohyoid, inferiorly we have the clavicle. So clavicle, inferior belly of homohead, sternocleidomastoid. They are making the boundaries for the subclavian or the supraclavicular triangle. So I have told the upper area large one is the occipital triangle, which is formed by the whatever the be bounded by the anteriorly sternocleidomastoid, posteriorly trapezius, inferiorly we are going to get, or the base is formed by the inferior belly of homohead. You have come across superior belly of homohead and inferior belly of homo, that is our. This is inferior and superior belly of homohead are very important to divide the triangles, anterior triangle into subtriangles, also superior belly, and the inferior belly is important to divide the posterior triangle of neck into a two. So this is all about the definition. Then I have told what is the boundaries of the posterior triangle. Then I have told the roof of the posterior triangle, then floor, then subdivisions of the posterior triangle. So as we have come across what are the content of the posterior triangle, here I have shown the few contents which is you can remember. So what are the contents you are going to get in the posterior triangle? So this is a chart which is you can remember what are the contents of the posterior triangle. So it contains the nerves, vessels means arteries, and we have the veins, then nerves and lymph nodes and lymphatics. Those are the contents you have to make. As you can divide the occipital triangle and subclavian triangle. So in this occipital triangle, in the nerve, first content in the nerve, occipital triangle contains the most important, which is supplying the sternocleidomastoid muscle and trapezius muscle, is supplied by the spinal accessory nerve. So when you go to the spinal accessory nerve, you have to remember the trapezius, and which is you can remember about the that is the sternocleidomastoid muscle. Also contain four cutaneous branches of cervical plexus. Means we have come across these nerves as a part of the roof structure. Lesser occipital, greater auricular, anterior cutaneous nerve of the neck, and supraclavicular nerve. These all are the nerves. Four cutaneous branches you have to remember. Muscular branches which are traveling into the as a content of the posterior triangle are two small branches of levator scapulae and trapezius branch, and we have the nerve to rhomboides. So rhomboides, trapezius nerve which are supplying, those branches are as a content of the in the occipital triangle. Then we have the vessels, transverse cervical artery and vein, and occipital artery. That is I have told. Then most important you have to remember, along the posterior border of the sternocleidomastoid, we have the group of the neck region. We have that is the lymph nodes of neck, which are situated along the posterior border of the sternocleidomastoid. Very important, not on the anterior. We are going to have the majority which are situated along the posterior border of sternocleidomastoid. We have those are the lymph nodes are situated. So these few at the upper angle also we are going to get it. So this all are the we call as the occipital nodes. Those are the content of that is the occipital triangle. So what is the important to remember in the occipital triangle contains in it is a subtriangle of posterior triangle, which contains the nerve like important. You have to remember spinal accessory nerve, lesser occipital, greater auricular, anterior cutaneous nerve, and supraclavicular nerve. These are the cutaneous. Muscular, you have the nerve to rhomboides and trapezius. So those two which is you have to remember. Then arteries, occipital artery, transverse cervical artery. That is you have to remember as a content. Lymph nodes I have told along the posterior border of that is sternocleidomastoid. Lymph nodes are situated. They will form one of the content of the posterior triangle. Then going to the next part, which is next triangle, which is you should remember subclavian triangle. So what is a subclavian triangle? Which contains the lower part of the triangle, posterior triangle, so that above the clavicle, what are the contents comes? Those are the I have told shown in the diagram. Three trunks of we get the brachial plexus. what are the brachial plexus which is you are going to get, those trunks which are you are going to get, that is we call as the 3 trunks of brachial plexus. Then serratus anterior nerve. Then we are going to nerve to subclavius and suprascapular nerve. Then in the arteries we have the third part of subclavian artery and suprascapular artery. Then we are going to have the lower part of external jugular vein. Those are all we call as that is the arteries or the vessels contained in the, that is a subclavian triangle. And nodes, lymph nodes, very few members of the lymph nodes are situated in the, that is the subclavian triangle. But majority on the posterior border of sternocleidomastoid, there is a maximum lymph nodes which are situated. They are the major contained in the occipital triangle of the sub-triangle of, that is we are going to get in the posterior triangle of neck. So these are the content chart you have to remember. You have to proceed from the nerve, important nerve. Most nerve you have to important remember is the spinal accessory nerve as a content in the occipital triangle. Then all lesser occipital, greater auricular, suprascapular nerve. These we have come in the roof structure. So that roof structure nerves which are included in the content of the occipital triangle. Next you have to remember 2 small branches of muscular branches we get as a trapezius and rhomboidus. That is a nerve to rhomboidus. Then you have to remember arteries, occipital artery. Occipital triangle containing occipital artery, that you have to remember, and transverse cervical artery and its vein. These all will be included. Lymph nodes, you have to remember, very important. Clinically it is very important because we are going to see the palpation of the neck region lymph nodes. Lymph nodes supraclavicular, or either we can palpate the posterior border of the sternocleidomastoid muscle lymph nodes. So those are clinically very important. Enlargement of lymph nodes, lymphadenitis is you have to examine the patient. When you are examining the neck region, you should concentrate, is there any enlargement of lymph nodes in the neck region. You can diagnose the early signs of the cancer also, because left supraclavicular lymph nodes are very important to palpate the when patient you are examining, because you can detect the cancer. And lymphadenitis, posterior border along line, there you can palpate the or any enlargement of lymph nodes, you have to see that. Then you are going to the that is subclavian triangle. In this you have to 3 trunks of the brachial plexus. You have studied the brachial plexus. So we are going to get the upper, middle and lower trunk. All 3 trunks will be included as a contents of the, that is the subclavian triangle, or we are supraclavicular triangle. Nerve to subclavius as relates to the subclavian triangle, nerve to subclavius and suprascapular nerve, that you have to remember. Then I have told the arteries, you are going to get subclavian artery. So this is the one which is subclavian triangle. You have this nerve to subclavius. Then I am talking about the subclavian artery. So in this way you can remember the content of the, that is the subclavian triangle. Then lower part of external jugular vein, and very few members we get the lymph nodes. So this is the one which is you have to remember about the chart, that is gives the idea about the contents of the posterior triangle of neck. So whatever we have studied, first to revise fast. So in this we have come across the what is the posterior triangle and definition. Posterior triangle is a triangular muscular space situated behind the sternocleidomastoid muscle. Behind, that is we call as a posterior triangle of neck. Then whatever the area which is having the boundaries, you are going to get here posterior triangle, you have to label and practice this diagram. Then this is bounded by anteriorly by the posterior border of sternocleidomastoid, and posteriorly by the, we have the, that is the trapezius muscle. Then inferiorly middle 1/3 of the clavicle. Apex line, meeting point of the sternocleidomastoid and trapezius at the superior nuchal line. Then I have told the roof structure, you have to remember almost all it is formed by the, that is structures which you can remember. investing layer of deep cervical fascia, which is contains or which covers the first one contains the platysma muscle. Then we are going to have the nerve, cutaneous nerve, that is supraclavicular nerve, greater auricular, lesser occipital nerve. Then we have the external jugular vein. So that is you have to remember in the including platysma, it will form the that is the roof structure of the that is a posterior triangle. Then you have to move to the what is the floor of the posterior triangle formed by the muscle. It is a deep investing layer of vertebral fascia, and that will contains the almost all from superior to the inferiorly, which will be having the muscles, deep muscles in the neck region. Those are forming the semispinalis capitis, splenius capitis, levator scapulae. Then we have scalenus anterior, scalenus medius. Then we are going to get scalenus posterior. So these scalene three muscles you have to remember. So this is all about the contents. Few contents you can see which are supraclavicular region, and here you have to add the upper digitation of serratus anterior muscle. So I have told the definition, then I have told the boundaries of posterior triangle. I have covered the roof and floor and contents of the posterior triangle of neck. So when the question is asked, describe the posterior triangle of neck, means you have to practice the boundary diagram, subdivision diagram, then roof diagram, and content chart you have to practice. So this is all about the posterior triangle of neck. So write down notes.